The member for Dawesville.
My question is to the Minister for Health. I refer to the Cook Labor Government's commitment to our public health care system and secure public sector jobs. And I ask, can the Minister update the House on this government's commitment to bring Peel Health Campus back into public hands after it was privatised by the Liberal National parties? And can the Minister please also advise the House how this builds on the government's redevelopment of Peel Health Campus?
The Minister for Health.
Thank you, Member for Dawesville. And today is a great day. It is a great day for this government and for the Peel and the Mandurah community. They finally have a hospital that is run by the state government, a hospital that is now in public hands. It is something that they have advocated strongly for decades. For decades. It was incredible to be there this morning for the transition celebration. The transition went very smoothly, to see all of the staff standing proudly in their South Metropolitan Health Service uniforms that they had helped design, feeling very proud and very happy to be part of the WA Health family. And it has been long advocated for, in particular the member for Mandurah, who has weathered some incredibly turbulent times down there under the former Liberal government and former provider. I'm very, very proud of this government's commitment to public health care. Very proud. It is only Labor government that is focused on the public health system and public health workers. That includes permanency for WA doctors, the introduction of nurse-to-patient ratios, the strengthening of our junior doctor workforce by listening to them and implementing them and the reforms that they need. This government has a strong track record on public sector jobs, in particular on healthcare. And finally, Peel Health Campus is part of that family. 95% of existing Peel Health Campus workers elected to come over and work in the public system. That is a huge endorsement of our public health system, and it is a great place to work. There is more than 1,000 doctors, nurses and allied health and support staff who will now work at Peel Health Campus. And to remind people that it is this government who has honoured their existing entitlements and a range of enhanced entitlements in working for the public sector. They get an additional 4 weeks parental leave, enhanced casual loading, 13 weeks long service leave, paid family domestic violence leave, superannuation on up to 12 weeks unpaid parental leave, and their existing entitlements recognised and transferred over. That is absolutely not. Absolutely not. And this paves the way for the redevelopment of that hospital. Now that it's fully in public hands, we can get on with the redevelopment of that hospital, which is more than 60 inpatient beds, more mental health inpatient beds, 15 palliative care hospice beds, the introduction of the Mental Health Emergency Centre, another operating theatre, 12 chemotherapy places and more outpatient services. There will also remain, importantly, access to private health care by Ramsay, which is an important choice that people in that community want to maintain. Now, I do want to reflect on what it was like 10 years ago in the theme of remember when. Remember when the Liberals were running Peel Health Campus. In 1997, they gave a 20-year contract to Singapore-based Healthcare Solutions. And they 20 years.
And we returned it back to the government. That's what it should have been right from the beginning. You had a health minister.
Order, please. All right. 2 people I'm asking not to interject any further during this question. One is the Leader of the House and the other is the member for Vass. Minister, you've got the call.
Thank you, Madam Speaker. And those opposite, the Liberals, continue to defend Healthcare Solutions. They continue to defend their dodgy operators who treated staff badly and
Member for Vass.
Standards.
Member for Vass. The potential is there for me to ask you to leave the chamber and not come back today. Just understand that if you want to ask another question. Minister?
Not only did the Liberal Party defend Health Solutions' dodgy running of it, they pre-selected a senior executive in Tony Solan, who shared a campaign office with the Health Minister at the time. They also happened...
Sorry, Leader of the House. The member for Vass is now compliant with my request. I'd ask you to be compliant with it too, because the same applies to you. And I think you've got an important role you need to stay here for. Minister.
Thank you, Madam Speaker. And at the time, they'd pre-selected a senior executive of Health Solutions who shared a campaign office with the then Liberal Health Minister while the company was seeking a 60-year contract and $75 million redevelopment. Members, it's had a stench all the way back to Perth. The whole thing stank, and the community saw right through it. And they remember your record. Now, we have worked hard to fix those mistakes, and Ramsay stepped in at the last minute and helped to resolve many of those issues, but we have done what the community has asked us to do, and that is bring it back in public hands.